Hi, everyone. Thank you so much for joining today's webinar. I really apologize for the technical difficulties and for being on mute just there at the start. But we are really appreciative of you all joining us today for our Election Outlook and Advocates Guide to the Election Cycle webinar. This is the first webinar in our three-part Election Outlook series, and I'm Melissa Burroughs, the Senior Manager for Strategic Partnerships at Families USA Action. For those of you who aren't familiar, Families USA Action is a 501c4 organization dedicated to achieving the best health and healthcare for all, and it is the host of today's webinar. It is a sister organization of Families USA, of which most of you are probably familiar. Before we start, as a reminder, this event is open to media, will be recorded, and it will be posted to the Families USA Action website. Our speakers today are Lisa Hunter, the Senior Director of Strategic Partnerships at Families USA Action, and Geoff Garin, the President of Hart Research Associates. So I'm going to go to the next slide for today's agenda. Today we will cover the landscape of health issues driving the conversation this election cycle, do a deep dive on polling and issues that are resonating in rural America, which will be a key driving force in this election cycle, and then finally we'll cover resources to help you engage. So to kick it off, I'm going to turn it over to Lisa to fill us in on the healthcare issues that are driving the day.
Thanks, Melissa. Hi, everyone. Delighted to be joining you all today. And as Melissa said, I'm Lisa Hunter, Senior Director for Strategic Partnerships at Families USA Action. And I'm going to be going through the landscape and issues we know that are gaining traction this election cycle. But first and foremost, we can't talk about the elections without first acknowledging the unprecedented moment we're living in with the COVID-19 virus shaping every facet of our lives and lives across the nation. Next slide. Okay, so at this moment in time, understanding the election's implications for health policy and the issues likely to drive the day requires us to really reflect on where we are. And I know we've all heard these sobering statistics before. We're coming up on 200,000 lives lost to COVID-19, including more than 3,000 veterans and over 135,000 seniors, an estimated 6.5 million cases nationwide. 13.6 million individuals are without jobs, and this includes 7.8 million newly unemployed and 4.6 million who have left the labor force altogether. We released, or rather Families USA released in July 2020, a report that estimated over 2.5 million healthcare jobs in danger within the healthcare sector alone. The unemployment rate more than doubled between February and August of 2020, so 3.5% in February to 8.4% in August. And then from February to May 2020, we've seen an estimated 5.4 million who were in the process of losing their health insurance. And then, of course, something that we'll be talking about quite a bit today is people of color who are experiencing these death cases, job losses at disproportionate rates. Next slide. And as we all know, and as you can see on this map, COVID-19 is shaping the landscape nationwide. And unsurprisingly, what we're seeing is California, Florida, New York, and Texas having the greatest number of cases and deaths. But to be fair, I think there are spikes all across the Mid-Atlantic, South, Midwestern states too. And going into the election, and as is going to be reinforced here, the pandemic is top of mind for folks across the country. Next slide. And this basically says it all. Though COVID-19 has affected everyone in the nation in many ways, the pandemic has had a disparate impact on communities most often marginalized, particularly Black, Indigenous, Latinx, and other communities of color and other traditionally underserved communities. And there are also inequities in the economic impact of COVID-19, with Latinas and Black women experiencing greater financial strain, which you see here on the left. And it's further compounded by a widening racial wealth gap in the United States. And disparities in COVID-19 health outcomes are stemming from health inequities that we know are rooted in systemic and unjust social and economic policies. And just looking at these graphs and the findings, it's astounding and devastating to see how the virus has inflicted significantly more harm in these communities. And given the communities that I think many of us on the line today represent and the constituencies we're advocating for, we're seeing a significant opportunity now to be focusing on health equity, holding elected officials accountable, and really equipping policymakers with policies that really help address these gaps and are focused on these communities that have historically been ignored and excluded, frankly. Next slide. And then we've seen, unfortunately, new data showing that the death rates among Black and Latinx individuals are much higher than for white people across all age categories. As this slide reflects, children of color are more likely to develop serious complications and are 5 to 8 times more likely to be hospitalized. And this is, I think, certainly something worth noting and probably worth more coverage and headlines, especially in light of students returning to schools and daycares at the moment. And we still don't know the long-term consequences or effects of COVID-19, but what we do know is that it is critical to be applying an equity lens in our pandemic response and recovery efforts. Next slide. And of course, I think as a backdrop to all of this, there's just a lot that folks are digesting, and we're heading into an election season where things are constantly changing and new issues keep coming up. And between the job market, election security, unemployment insurance expiration, schools reopening, ongoing protests around racial injustice, wildfires, hurricanes, the never-ending updates on the status of the pandemic, a vaccine, new research, new controversies, I think we all have quite a lot on our minds. And so it's difficult for any one issue or even one set of issues to really break through. And the issues driving the day could change even in a few short weeks until the election. But we'll be talking more about this and the noise that folks are sort of hearing and voters are experiencing at the moment too. Next slide. Despite the noise, a number of key health issues are still breaking through and shaping the conversation and resonating with key constituencies. And I'm going to tee this discussion up, and Geoff will take it a layer deeper in a moment to discuss the specific polling and voter insights that he's been able to glean through his research. But if we go to the next slide. Again, the pandemic has brought a number of health and healthcare issues to the forefront, shining a harsh light on our healthcare system's gaps and failures, our country's slow and inadequate pandemic response and preparedness, and this nation's longstanding systemic inequities. And I think for all of us, the COVID-19 pandemic really shapes and dominates the landscape that we're all operating in, as most of us come from the health advocacy space. And as we think about health and healthcare issues during the election, even ones that have been top consumer issues for years, we're all now looking at them within this new context and this new light. But saying that, make no mistake, COVID-19 has imposed significant hardship on families across America, and at the same time underscores some of the most perverse incentives and systemic shortcomings, really providing a renewed focus for all of us within the advocacy community. Next slide. In particular, the issues driving the day are those that are related to the cost of getting healthcare, treatments, prescriptions. And when we talk about costs, we're really defining it as costs being a pocketbook issue, not the underlying prices, although that's certainly relevant. Health insurance coverage is another, especially coverage losses due to the pandemic, and much more so on conversations around plans related more so than talking about coverage, more so than the universal coverage proposals that we've heard in pre-COVID-19 times. Access to care is another issue. And then to some degree, and possibly more than ever before, we are seeing a renewed greater focus on health equity and the impact on certain communities. Next slide. For many American families, the cost of their healthcare has been just a kitchen table issue for years. I don't have to explain that to this group. I think we all are very familiar with that, and that the pandemic is now shining a new light on longstanding problems here, particularly as budgets are shrinking for families. Many are losing their health insurance. The cost of care continues to rise, and the cost of COVID-19 related care is actually making headlines. I'm sure you all have seen. Families similarly across the country are continuing to be painfully aware of the high and rising costs of prescription drugs, particularly when they start to think about potential COVID-19 treatments and vaccines. What we've seen going into the pandemic is that 9 in 10 voters are worried about rising costs due to of drug prices. And that seems to be holding steady into the COVID-19 pandemic. We know that millions are struggling to afford the medicines they need, and that prices are continuing to rise. Families USA has done some research here. And then, insert into the mix COVID-19 treatments and vaccines that are under development. That's a whole new complexity to the issue. Will treatments and vaccines be available? For whom? What about affordability? Will they be safe? What about efficacy? And all of these questions continue to swirl. Meanwhile, families are also continuing to worry about surprise medical bills, especially as we see these bills crop up on things like COVID-19 tests, which everyone should be getting at an affordable price. And should be getting covered if they are under a plan. Nearly half of Americans say that they or somebody in their family received a surprise medical bill. Most people in the country worry that, most people in America worry they would not be able to pay for a surprise bill if they were to get one. COVID-19 tests can come with some unexpected and unfair costs up to thousands of dollars. There's been some coverage of this lately. And some states have actually taken it upon themselves to lead the way in tackling this issue, both, I think, at a macro level before COVID-19 hit our shores, but certainly as COVID-19 began to take hold, certain states and jurisdictions have taken a step to implement consumer protections around testing and coverage for tests. And this still, as a sort of national solution on surprise medical bills, has stalled. Next slide, please. And through the primary season, much of the national healthcare conversation, if you guys will remember, was focused on universal coverage proposals and things like Medicare for All, but that is all completely shifted, and families in America are worried certainly about their health coverage, particularly the millions who have lost insurance along with their jobs in the past several months. But health coverage and the focus here has really evolved somewhat, and so we're continuing to see focus on the uninsured, looking at coverage losses pre and post pandemic. So there was data released in the last few days from the Census Bureau showing that we actually saw some declines, pretty significant declines, even before the pandemic hit our shores. And certainly Families USA has done some research on estimating coverage losses since the pandemic took hold. But that coverage losses still, are an important focal point for the advocacy community and certainly for Americans writ large. Underinsurance and the comprehensiveness of insurance continues to be a focus as well. So you'll see here from 2010 to 2020, 52% increase in proportion of underinsured in employer plans. One of the things that's really straining, families across the country is the trickle down of state budgets really experiencing shortfalls, particularly at this very unprecedented moment. And the impact that has then on Medicaid and the cuts and the really difficult decisions that some states have started to make around Medicaid coverage. And what you'll see there is things like, benefits will go to the wayside, for example, oral health benefit. And unless Congress is able to actually provide significant funding to states, this is just the reality that a lot of states are facing at the moment in their Medicaid coverage and Medicaid programs. And then we see, huge opportunities. It's a big question mark. I think the way that the election is going to play out and what opportunities that really makes available to advocates on the coverage agenda. And what would that look like done under another 4 years of the Trump administration versus a Biden administration, and take that a layer deeper and looking at states still seeking to expand Medicaid or implement other sort of coverage provisions outside of Medicaid. And then the Medicare benefit, what's going to happen there in terms of, we just saw HR 3 in this last push over the last year. Where does that sort of leave us dependent upon the results of the general election around dental, vision, hearing, long-term care, catastrophic costs? Quite a lot to mash on in the coverage bucket. Next slide, please. And then carrying through the earlier threads, if there is a silver lining here, the past several months is that there has been a growing national dialogue around health equity. And between COVID-19's disparate impact on vulnerable communities and the increased national dialogue around racial justice, particularly related to police brutality, we're seeing more and more media coverage related to equity and to some degree around social determinants of health too. This growing consciousness around equity provides some short-term policy opportunities, particularly related to pandemic response. So, for example, telehealth and reaching certain underserved communities or hard-to-reach communities, setting up longer-term investments in communities that are hit the hardest, contact tracing and testing. But it also means that, advocates are going to have to consider the sort of threats to equity that come with tight budgets. And so that is, not gone away by any stretch of the imagination. And going into 2021, there may be an advocacy window for advancing health equity, even though it hasn't traditionally been a top-of-mind healthcare issue in previous elections. We still have a long way to go, but renewed conversation may create some opening here. And now is the time to be doubling down on health equity advocacy. So with that, I'm going to turn it back to you, Melissa.
Great. Thank you so much, Lisa. We really appreciate all of your fabulous insights. And with all of these issues in mind, now it's time to consider what is driving the conversation with voters. And in particular, today we're going to focus on rural voters in battleground states, which will be a key constituency that often shapes the conversation in federal elections. So next, I'm going to turn it over to Geoff Garin from Hart Research Associates to speak to recent polling. Hart Research Associates is a nationally recognized firm that conducts public opinion research across issue areas. And Families USA Action commissioned Hart Research Associates to examine how healthcare issues are playing out in rural America as election day approaches. The following slides convey results from this polling that was recently completed among rural voters across the country, but that focus in on battleground states. So Geoff, please take it away.
Great. Thank you very much. Delighted to be with you. This slide should really say rural voters in battleground states. So we're not looking at battleground states generally. And if you turn to the next slide, this is research that we conducted on behalf of Families USA. We were in the field for this research from the very end of July to the very beginning of August. Sad to say, since the time we came out of the field, 40,000 more Americans have died from coronavirus. And as time goes on, a kind of greater proportion of those are in rural places, and which have been harder hit as the pandemic has spread. On the next chart, we did, we interviewed, pardon me, a total of 805 voters who we took off the voter file based on indication that they live in rural areas. The voter file codes each person that way. And then once we got those people on the phone, we further verified that they live in a place that they consider either to be a small town or a rural area. We sampled this group in two different tranches. First, we interviewed a national cross-section of rural voters, and then overlaid on that additional interviews with rural voters in a collection of battleground states for the 2020 election. We're able to do a deeper dive on the battleground state voters because we have, in addition to the 400 that we sampled separately, some from the national sample also qualify. So we have a good deep dive on them. And these interviews were all conducted by telephone, combination of a landline and cell phones. On the next chart, one important thing to remember here is that this assignment really asked us to look at the role of healthcare issues electorally in the most challenging kinds of communities for progressive politics. You can see here that among rural voters, they're twice as likely to describe themselves as being conservative than liberal. They're more likely to consider themselves to be Republican than Democrats by a substantial margin, and the ones who are Republicans are more avid in their party affiliation than Democrats, in part because of just the composition of rural areas and then the swing states that we targeted for this poll. This tends to be a largely white sample, consistent with what we know about the actual demographics of these voters. And more than half describe themselves as being evangelical Christians, and as you know, many of them are very conservative in their politics overall. Just on the party question, 51% of our sample are not strong partisans. They either lean to their party affiliation or describe themselves as being completely independent. And in our analysis of the survey results, we pay special attention to those swing voters who are not kind of driven by partisanship. On the next slide. So one thing to recognize about the voters in these areas, even though these voters these areas tend to vote very heavily for Republicans, including President Trump in the 2016 election. 64% of all rural voters supported President Trump, according to the best analysis that's available. It's not that they are in love with Donald Trump today, or as of August 5th. You can see here his own favorability rating is kind of evenly divided with rural voters, only 5% more positive than negative, really quite remarkable given where he started out on Election Day 2016. They're definitely not in love with Republicans in Congress at all, as many have a negative feeling toward them as a favorable opinion. But frankly, there is rural voters tend to be harbor suspicion of Democrats for a variety of reasons, not necessarily because of health care. In fact, we don't think it is related to health care at all. It tends to be kind of other kinds of cultural issues and just their attitudes about the role of government. But you can see here that both Vice President Biden and Democrats more generally are pretty significantly underwater with rural voters. On the next chart. As I mentioned, according to the best analysis done by the kind of brainiacs at Catalyst, they calculate that 64% of all rural voters supported President Trump in 2016. In our interviews, we asked people to recall how they voted in 2016, and 58% recall having voted for President Trump. And now, when we ask people what they're inclined to do in 2020, only 52% say that they are inclined to vote for President Trump. So down from the 64% that we believe actually occurred, down also from the 58% that people in this sample told us, how the vote they cast in 2016. One of the things we're seeing here is that President Trump has kind of lost some of the votes he had, but definitely has not gained any new rural votes. And among the people who are voting for Joe Biden today in rural areas, 16% of them did not vote for Hillary Clinton. So although he's still behind in rural America, he's adding votes in a way that President Trump is not at all. And obviously, if you looked at this on a national basis, most polls have President Trump behind by margins of around 8% on average. On the next chart. So we asked voters to select the two most important issues to them, and you can see that at the very top of the list here are jobs and the economy, and then you have coronavirus and healthcare kind of in the next tier. But the important thing to note about this is that 52% of 50% of all voters choose either coronavirus or healthcare as one of their top two priorities. So some of that 50% choose them both. And among the people who are choosing coronavirus, which is obviously a healthcare issue in its own right, it's a deadly pandemic and deadly virus, or who choose healthcare, they're voting for Vice President Biden over President Trump by 58 to 31. So the more that coronavirus or healthcare are front and center for voters in rural America or really wherever, the more likely it is that they will be voting Democratic, and so it's kind of very important to raise the prominence of those issues. Among the other half of the electorate that doesn't pick coronavirus or healthcare, they're voting overwhelmingly for President Trump. We just did this nationally, and on a national basis, we have around 7 out of 10 who are voting for who pick COVID or healthcare as one of their priorities, and around 60% of them, a little over, are voting for Vice President Biden. So again, key takeaway here is that the more that the coronaviruses and healthcare are kind of the topic of the debate, the more likely it is that will move people to a more Democratic vote. And you can see that women voters are more likely to prioritize those issues. And among the people who had once been for President Trump and are not, they are much more likely than average to prioritize those issues. And to the extent that President Trump is losing votes in rural areas, there are kind of very clear indications that that's being driven by voters' attention to issues like coronavirus and healthcare. On the next chart, I do a lot of polling for members of Congress, and I often speak to legislative staffers or sometimes campaign consultants who think if they talk about the opioid addiction crisis, they've checked the box on rural health care. That isn't true at all. We find that rural voters have a wide variety of concerns when it comes to health care, driven mostly by the things that concern voters everywhere. The affordability of health care, their access to quality health care, their ability to get health care when they need it. We've seen in other research we've done in rural areas that there is a concern about the dissolution of rural healthcare infrastructure. And when we asked about that, we see that there's a concern about that, but when we ask specifically about what's going on today, that less than 40% describe it as a problem where they live. So it tends to be kind of more of a future-oriented concern for many voters. With the benefit of hindsight, I would not have. I made a mistake by grouping hospitals, emergency care, and specialized medical care into one category. What we are seeing in the research and other aspects of this research is that there's a greater kind of sensitivity to the problem of hospital care and emergency care than there is about specialized medical care. We're hearing, I think we are planning on doing another iteration of this with Families USA, and we'll take a deeper dive. one of the things that we want to look at is just the ability to, if they have a medical emergency, to get to the care they need, and the availability of ambulance care. Affordable dental care is, very much part of the mix here, and something I'm glad we added to the research. On the next chart, there are, we said that among the people who have defected from President Trump over the course of the past 4 years, moved away from him, that healthcare and COVID are front and center in that. One of the things is that we've identified a variety of aspects of the record of President Trump and Republicans in Congress that are particularly alienating to rural voters. And this gets to the availability of care, which is, we kind of talk about the degree to which rural communities depend on Medicaid as their only source of affordable health coverage, essential for the survival of rural hospitals and nursing homes. And yet President Trump keeps pushing for hundreds of billions of cuts in Medicaid, even as they give tax cuts to millionaires. That you can see that 57% say that they have that aspect of President Trump's record and the record of Republicans in Congress is concerning to them. Just taking the very top box response, you can see half of all of the Trump defectors say that gives them really major concerns about President Trump. This is not kind of healthcare delivery per se, but in terms of environmental health and the degree to which the Trump administration and their Republicans and supporters are following policies that create more environmentally born illnesses. That's concerning to people. And then the effect of the total repeal of the Affordable Care Act is significant, both in terms of people being affected and losing their coverage, but also what it means for rural hospitals and the loss of 38,000 jobs. The job aspect of this is pretty significant. On the next slide, one other thing is that among the defectors that I really want to point out here, and this is true not just in rural areas, but something that we see everywhere, President Trump's negligent, kind of failed leadership on the coronavirus is kind of the major driver of people who supported him before choosing him not to support him now. And here, the fact that he continues to downplay the threat, ignore the advice of experts, refuse to take needed action to get it under control, is a kind of concern for rural voters generally, but among those people who have moved away from President Trump, who told us that they supported him previously and don't support him now, coronavirus is by far the leading driver of that. On the next chart, we tested a variety of aspects of Joe Biden's and an agenda that we attributed to Vice President Biden and Democrats in Congress. You can see there is a favorable reaction to many of these items from a large majority of voters. And remember, these are all identified very explicitly with Biden and the Democrats, who start out with kind of very low ratings, as you recall from the beginning of the survey. And you can see that there is, very large majorities who like to hear about what Democrats and Biden are proposing in terms of adding dental coverage to Medicare and more support for rural dental care. We also find separately in a different survey that vision care is also another kind of Medicare benefit that people would very much like to add. Improving telehealth in rural areas, including for mental health and specialty care, strengthening the rural healthcare infrastructure by funding community health centers, and providing more funding to rural hospitals. So there are kind of many things that Democrats and Vice President Biden can and should talk about that speak to the particular interests of rural voters. But the thing I want to emphasize here is that not everything has to have the word rural in it to be important to rural voters on health care. That is, they care about the very same things that Lisa was talking about earlier in terms of reducing the cost of insurance, dealing with the high cost of prescription drugs. There's kind of almost universal support among rural voters, really voters across the country, for requiring, giving Medicare the power to negotiate with drug companies to get lower drug prices. So there's a kind of a major reaction we find among rural voters to the same things that drove the 2018 election toward Democrats. That is, the policies of Republicans and the Trump administration that undermine protections for people pre-existing condition and would allow insurance companies to raise premiums for older people. Remember, the rural voters tend to be older than average. On the next chart. So that is it. Again, what we are showing you for rural voters is kind of a microcosm of what is true with voters overall, that coronavirus really has taken not just a toll on the lives of way too many Americans, but really taxed voters' support for President Trump, who previously supported him, and is kind of driving voters away. And that the more that the debate in the campaign is about COVID and about people's access to good quality, affordable health care, the more likely it is that they are to entertain a vote for Vice President Biden and for President Trump. So I hope that is helpful to you, and we'll look forward to the next iteration of this.
Great. Thank you so much. I really appreciate you sharing all of these insights with us today. And so next slide. To wrap this up, I'm going to share a few resources to help you all stay engaged in this conversation so that we can continue to work together in raising some of these critical issues through the election season. So next slide. Some of the things that you should be looking out for coming from Families USA, our sister organization, are the next two webinars in this series. So mark your calendars for Wednesday, October 7th at 3 p.m., where we will be going over health messaging frames that move the needle. This is a next set of resources around messaging that will give you all narratives in which we can talk about some of these big health issues in ways that will be appealing to the broadest possible audience and help them kind of break through all of the noise. And then on the day after the election, Wednesday, November 4th at 3 p.m., we will be having an immediate debrief webinar, the election results and what they mean for health. We realize that this is an interesting election year, and we will report on what we know that day after the election, and we may need to have an additional webinar later on to share additional results as they come in. The other thing you should look out for coming soon is a rural health policy report and a summary of the polling that you just heard with both some of these sort of C4 takeaways that we heard from Geoff, as well as some messaging that comes in a more C3 package that you all can reproduce and use. And then next slide, some other resources for you all to keep in mind as you are engaging in advocacy over these coming weeks. If you are new to election year advocacy and you're looking to get more involved as a 501c3, the Boulder Advocacy resources are really effective. That's that first link. If you're looking to engage your candidates directly, but you're not sure how to find them, Ballotpedia is a good way to find them. And then for those of you that are particularly interested in oral health issues, The Oral Health Progress and Equity Network has put together a number of really good resources that will be really straightforward ways to engage candidates on oral health issues, including questions to ask your candidate about those issues, since that's, as Geoff mentioned, something that is top of mind to a degree. Or top of mind isn't quite right, but something that is favorable and popular with voters. It may be something that you are interested in raising in your advocacy. So those are the resources we have, and this is the end of our presentation for today. So we really appreciate you all joining us here at Families USA Action for this presentation, and we look forward to continuing this conversation next month when we learn more about messaging frames. So thank you all for joining us. Again, apologies for the technical difficulties, and have a wonderful afternoon.